some mom pinched me.
Pinched you?
Yeah, because I said, oh, what's today? And she's like, oh, it's St. Patrick's Day. And she saw I wasn't wearing green, so she pinched me on the way out. And I was like, this is why there's legislation in place that hurting a nurse is a felony.
And then I proceeded to call security. And we tackled her to the ground.
No, I said something stupid about how I was Irish. And I was like, but wait, I'm Irish. And she's like, oh, you are? And I was like,
Did you check if you were wearing green underwear just in case?
I was wearing, no, I'm not going to say what color. But no, I was not wearing green underwear. I was wearing black underwear.
My last shift, I had a 25-year-old cancer patient.
Oh, no.
Who needed help with his pants so he could use a urinal. This patient should get his own episode because he was really weird. He didn't need help with like the urinal or anything. He just needed like a boost to hop off of the bed to use the urinal.
Oh, one of those.
Yeah, so he got off and then he like unbuttoned his pants and then pulled down his pants and it was like leopard print panties.
Panties?
I don't know, man.
Like not boxers?
If it's leopard print and bikini cut, I was just going to assume it was panties.
Shoot. Yeah. And that's one of those things that you're not going to like make a comment about it. You know?
No.
You're just going to say, okay, that happened and then move on. And then you just deal with the trauma later.
Yeah, I'm bringing it up during my next counseling session.
Oh, man.
I'm going to put it on the next prayer request card.
Oh, seriously,
that comes my way.
You never know how those things affect you until like 6 months later and you get a flashback and you're like, oh, shoot, that was traumatic.
And then because he was sensitive to light, he had these giant sunglasses on too, so the whole look just made me really uncomfortable.
Tell me, what was going through your mind at that point? Like, did you feel violated in some way? Like, no. Dirty, used?
No. I didn't feel dirty. I just felt like it's that now I've seen everything feeling.
Oh, yeah.
I know I haven't seen everything, but like that was just a confirmation of, wow, there's just things and people out there.
No, people are weird. Yeah.
That's probably a good segue into what we're going to talk about today. I'm David.
Oh, I'm Matthew.
And this is the Handoff Report, the podcast about the cool stuff nurses do and have to see, and why it matters.
It's been so long I can't remember what we were
and why it matters. Today we're going to talk about. So I'm going to share and Matthew's going to share our top 5 patient pet peeves.
I thought we were going to go back and forth.
I think we're going to go back and forth.
I didn't have 5.
You don't have 5?
Well, I'm kind of thinking them up.
Come on. You have to be disciplined and pick your top 5.
Okay. In no particular order, my top 5.
So we want to make a distinction that we've had rude patients before. Like patients be rude to us. And that doesn't necessarily make it like when they've been mean to us or like actually like hit us or something. I'm not counting that as a pet peeve. I'm counting a pet peeve like something a lot of people or a lot of my patients have said or done, and that it unwittingly annoys me. Like they don't do it on purpose, but it is something that I just wish they wouldn't do so much. Does that make sense?
Yes, it does.
Okay.
It does.
So maybe we share some of them, but I'm going to start with here's number 5 for me. When they won't speak for themselves, when the patients won't speak for themselves.
Oh.
That'll really annoy me.
In what capacity?
So the patient will come into the ER and then with their family member, and I'll walk in and be like, what brings you to the ER? And then the patient will just look over at their family member and the family will be like, well, he has a headache and he's nauseous.
Oh.
And so whenever that happens, that just always bothers me. Like, can you not talk for yourself? So lately I'll kind of play dumb and be like, oh, he can't talk for himself. and then the patient will immediately
Yes, I can.
Exactly. He'll be like, well, I can talk for myself. I'm just in so much pain. Okay.
Do you feel like you've gotten less compassionate or more of like a realistic person?
No. I can tell when they're being just slightly dramatic, you know?
Oh, okay. Yeah.
Because being in too much pain to talk, that looks a certain way. But if you're like on there texting somebody and not answering my questions to my face and letting your family member do it, that's what doctors call positive phone sign. I've heard them do this.
Ooh.
They call it positive phone sign. They must not really be suffering all that badly if they're chilling and watching Netflix.
But then you get into the whole,
texting.
like, they have their own pain tolerance and
Oh yeah.
people with chronic pain. But yeah, I get that.
But that's a pet peeve for me. If I have to like sometimes ask nicely to the family members, yeah, I'd like to hear it in the patient's words, you know, what's going on, because I don't want like a rehearsed story.
But even my first week, you'll have people come in for something like really dumb.
Mm-hmm.
Well, I shouldn't say dumb, but just really minor.
Mm-hmm.
You know, where they're like, "Oh, I need a vaccine," and you're like, "So, you went to the emergency room to get a vaccine?" that would be, I guess, I'll call that my 5, but in no particular order.
So your first one is that patients will come to the emergency room for non-emergencies?
For non-emergencies. Because it's called the emergency room. You shouldn't be coming to the emergency room because you want to get a tetanus shot. You know what I mean? That's not an emergency.
And get a day off work. Well, it's pretty
exactly, because then
yeah.
you have to write them. Don't even get me started, because then you have to write them up like a work excuse and all this stuff, and you're like, you totally could have
gone to a CVS,
but
or an HEB. I bet it would have been 5 times cheaper.
Oh yeah,
at
absolutely.
an HEB,
unless they're covered by what is it, Medicare, Medicaid.
Yeah.
Anyway, that's besides the point.
If you're gonna be upset about non-emergencies, wait till you get sickle cell patients.
Oh,
because their sickle cell patients they can show up and be really pain med seeking, like narcotic seeking. And it's valid because they have sickle cell and they're having sickle cell crisis and they're having pain. So now, unfortunately, what happens is that they become dependent on narcotics, and they'll come to the ER where they'll know they'll get them because they have sickle cell. So we have like at least 5 different patients who we know who they are. They come at least 3 times a week to the ER.
3 times a week.
And then we give them like 3 rounds of narcotics and Benadryl and either discharge them or keep them in the hospital.
Man.
And that'll really annoy me because they're stuck so much that they all have ports in their chest. So we need to access those.
Oh,
and
that's a pain.
Yeah. And then it's also a pain because some of them are nice and they know that they are regulars, so they don't bug you for pain medicine, but some of them are not as nice and they feel entitled to their pain medicine. And then one of the doctors put it well. He was like, sickle cell's just tricky because he's not here because of pain. He's here for drugs, but because he has sickle cell, then that's like a free pass.
Mm. Seems like a catch-22 type of thing.
Oh yeah. So, I mean, these patients are yellow and they have sickle cell. So the compassionate thing would be to help them out, you know?
Yeah. Yeah.
Anyway, my number 4 patient pet peeve for me is when they keep asking for things after I've told them no.
Oh.
Yeah. It's not just with dementia patients. Okay, I can have a little bit of understanding for dementia patients. I've had plenty of patients where they'll say, "Can I have ice chips?" Right? And they're in the ER for a GI bleed, so they can't eat or drink anything.
No.
Yeah, they can't eat or drink anything because they'll probably go for a procedure or something. So they'll be, "Can I have ice chips? My mouth is so dry." I'm trying to get into this habit of, instead of just saying no, being intentional about when it's going to turn into a yes.
Mm.
So it's like, I'll bring you ice chips once we're done with all our testing. So that's how I'm trying to respond. I'll bring you ice chips or I'll bring you crackers once we're done with all the testing. But then, like, next time I'm in there giving them medications, the patient's like, can I have ice chips? Like, no. Because my answer's not going to change if you just ask me more.
Right.
You know? But I think there's just a misconception of my role.
Oh.
You know? Like,
you're not Mr. Ice Chips.
I'm not a narcotic nanny. I'm not their waiter, you know?
I feel that.
So, like, if you're at a restaurant, it is acceptable to keep asking the waiter for breadsticks until he freaking brings you the breadsticks, right? But in the ER, you need to follow the nurse's directions.
Right.
Because when you go to the ER, you're implicitly signing your life away to... I won't go that far, but when you're in the ER, you're kind of implicitly trusting yourself to your nurse.
In a way, you are signing your life over. Not to be dramatic.
But that really grinds my gears because I feel like I'm wasting so much time repeating myself.
And you're working with grown adults. You don't want to, like, you shouldn't feel like you have to baby them.
Exactly. Oh, but that happens. And I know that comes with the job, but
sure.
I really appreciate when patients take my answers at face value and work with me, you know? Like, okay, no, I'm going to patiently wait until all the testing's done, you know?
Well, I think that speaks to a larger frustration of, like, having no credibility in what the nurse is saying.
Yeah.
Too. Which is a big frustration of mine. Like, you'll walk in a room and be like, okay, like, this is what's going on. This is what they're doing. And they totally ignore you. Mm-hmm. And you're like, okay, cool. It's going to be like that, huh? But that's mostly an inpatient issue. Because when you walk in, at least in my first week, I'm speaking off of about this much experience. It's a tiny amount. They tend to be a little more receptive. When you walk in, you're like, hey, this is what we're doing. They're going to be like, oh, okay, cool. Mm-hmm. Whereas if you're an inpatient, they might have been there for like a week and they're like, yeah, cool. Just
gotcha.
We'd like to have breakfast now. But that speaks to a larger thing where, in a way, healthcare is a service industry. Mm-hmm. But it's different than, you know, walking into McDonald's.
Red Lobster.
Red Lobster.
Not a sponsor. Yeah. But their biscuits are good.
They are. They are.
If a child wants a snack and they don't take no for an answer, then you're going to be less inclined to give them a snack.
Sure, at all. But that's just humanity in general. Where, like, if you're kind and, like, courteous, generally you'll get further than if you aren't those things.
So, like that Veggie Tales song said once, better, if you've gone a little loopy, better keep your nurse well paid.
That's a good life lesson.
That's a great line. That's a great line for a kid's TV show.
Entitlement doesn't look good on anyone in any situation.
No. So what's your number 4?
I was just gonna kind of backpack onto yours. That's kind of mine.
Yeah.
That's a pet peeve of mine, where either they don't listen to you, mm-hmm. or they take like little. Is the word credit? Is that the word I'm thinking of?
They put little stock into what you say?
That's it. They put little stock into what I'm saying. Mm. Whereas, you know, and a lot of times the doctor will be like, go tell them this. And you're almost, you know, like the telegram boy for the doctor in some way.
Courier.
Or they'll text you something and like, oh, can you tell them this? Can you tell them that? And then you tell them and they're like, we'll just wait for the doctor. Thank you.
I know.
And I'm like, okay.
I know.
My work is done here.
Number 3 for me is, we're getting to the ones that really, really ruin my day. Number 3 for me is when they ask for food or TV within 1 minute of arriving.
Oh, really? That one gets you?
this is usually the older population, because the older population, they have a hard time like grasping priorities, right? I've just found that like as people age, they might be one track minded about a certain thing, and then that's what they'll think about. Or they've been to the ER so many times, or if they've been to the hospital so many times, I guess they take some things for granted, right?
Yeah.
I'll see this the most in elderly patients who don't know how to, they've kind of lost a sense of prioritization. Or I'll see it in patients who are like frequent the ER. So we're talking cancer patients, people who are in hospitals for like significant portions of their lives. So cancer patients, hem-onc patients, dialysis patients, invariably they'll pass out at home and have like their head cracked open. And when they show up to the ER, I don't even know their heart rate yet. And they're like, how do I turn on the TV?
In that specific accent.
Yes. Well, no, they have, if it's a dialysis patient and they've missed 5 days of dialysis, because that's what dialysis patients do, that'll really get me, because as I'm trying to wrestle a blood pressure cuff onto their arm, they're trying to reach for the call light and turn on Fox News. And I'm like,
yeah,
you don't even know my name yet. And so I'll chastise them. I won't chew them out and I won't yell at them. I'll chastise them.
It's more professional that way.
No. Redirection. That's what I'm gonna call it. I redirect them by saying,
Gotcha.
Sir, that's not the priority right now. Let's get this blood pressure cuff on you. And this happens with older people too. The saying that I tell my nursing students is, these people, you just have to accept
these people.
You have to just accept they're gonna come to the ER with a full bladder and an empty stomach. That's just, you just have to accept that. These people, they're going to show up. They're going to like swear at you up and down because you won't give them food. And then at the same time, they're just going to keep profusely wetting the bed.
It's like a game to them. They're like, let's see how pissed off I can get them. Oh, man.
Okay, Matt, what's your number 3?
I think my number 3 is... See, that's like the difference between working with adults and kids. Some of those things don't apply because they're in the category of minors, you know, like they're kids. Yeah. So you can't be like, oh, they're not acting their age, because like they're 5, so they're going to be doing all those things.
Exactly. If these people were, let me say these people, if my patients were 5 years old, I wouldn't have this list.
Right. And I think that's the disconnect. But with that said, I think my number 3 is when they make like a big deal about getting vital signs. Like, you know what really just ticks me off?
That's really good.
Is when I put a blood pressure cuff on a kid, and it goes, and he's like, oh, it hurts, oh, it hurts, and I'm like, shut up. This is necessary. And they make such a huge deal out of it. You know, they just like play it up that how much it hurts and it's such an inconvenience. And I don't want to keep this thing on my finger. And I'm like, it's literally like a Band-Aid with a light on it. That's all it is, you know? Or like the leads, or, you know what I mean? Just all of it. And nothing, sometimes it's like a baby, so I get it. You know, they're going to kick, they're going to scream.
Yeah.
But sometimes I'm like, you have the self-awareness, that's the word, to realize that this is a necessary thing, and yet you still need to make my life
yes, if at 6 years old and at home with your Nintendo Switch you have the capacity to understand that Princess Peach needs saving, then I think
that's a good analogy.
I think you can have the capacity to realize we need to squeeze your arm every half hour.
Yeah, exactly.
But you know, it's a scary place.
Don't turn me into a...
No, you're a monster. You're a monster.
No, and I get all that, but it just still, I'm like... Because it's clockwork for me, you know? On the floor, it's every 4 hours, depending on their ESI. It's every whatever hours down there. And you're just like, here we go again. Here we go again.
So this isn't a pet peeve, but this is something funny for me, is when patients, I affectionately call these patients goldfish.
Oh, yeah.
Because
Yeah.
the dementia is so bad that they can't remember anything that you did 5 minutes ago. So what's funny is that blood pressures, my baseline for blood pressures, I take them every 15 minutes. But in 15 minutes, that's plenty of time for the dementia patients to forget they have a blood pressure cuff on them. So it's sad yet comical to me to see them be like, rediscover the blood pressure cuff on their arm every 15 minutes. And they'll look over at their son or daughter next to them and be like, "Oh, Jeffrey, oh, what is this? Oh, Jeffrey." And Jeffrey's like, "Dad, it's taking your blood pressure." And
Blood pressure.
it's taking your blood pressure. Because Jeffrey had to fly all the way from Wisconsin.
Poor Jeffrey. I would hate to be a Jeffrey.
Jeffrey had to fly all the way from Wisconsin just to make sure that his dementia dad didn't get admitted by the wrong doctor and that he got to be seen by the right cardiologist.
But good for Jeffrey for taking care of his, in this case, a father.
His pops.
His father. Good for him. And it's not like there's that much to do in Wisconsin. Besides what, like hunt and go to football games?
Pretty much.
Hunt fish and
eat cheese.
Have you ever been ice fishing? This is way off. I kind of want to.
I've never been ice fishing.
I want to go ice fishing.
I think we have an ice fishing pole.
You do.
But somehow we procured one in Texas where there's no place to ice fish. I was going to say, like... Well, because the reason why we have an ice fishing pool is because they're cheaper than they're cheaper than full-length poles. And I guess one of my parents was like, "Hey, this does the same thing.
It's the same thing, yeah.
We're not deep sea fishing. We can take something like this to the river or the beach and have the same results."
Sure, yeah. We need to go fishing sometime.
Yeah.
I'm trying to get all my gear together.
Yeah. So number 2 for me?
Yeah.
All right. These are the big ones. These last 2 that I'm going to say, right? They actually anger me. And I have to go like leave the room without saying anything and sit down for a second.
Wow.
Yeah. So here we go. When the patients won't say please or thank you. That's my number 2. Because it becomes 12 hours of lift the head of the bed.
Oh, yeah.
Bring me socks. Change the channel. I want ice chips. And it's like, that really wears on me. And so on more than one occasion, if it starts, so there's a difference between like asking me for things or bossing me around. So when they boss me around, I will redirect them. But if they're just asking me, I'll just like, okay, I get it. I just need to help this guy out. Mm-hmm. I'm not gonna like take it too bad. But I've had 1 or 2 patients who they're notorious for coming and actually like giving commands instead of asking questions.
Oh.
So so that's the difference for me. If a patient comes and he's like leaning on the call light like, "Can I have ice chips?" That's not gonna bother me as much as a patient who comes to the ER frequently, unfortunately, and he's always like, "Give me ice chips." You know what I mean?
Mm-hmm.
Take this out. Take me to the restroom. Change the TV channel. Where's dinner? You know what I mean?
Yeah.
Where's the doctor? It's like, for him, I've frequently had to be like, "Bring me ice chips, please." And then he'll always give me a look like, "Oh, shoot."
What? He's self-aware?
And then...
He has feelings?
Yeah. And then that'll work. He'll like try to say please for like 15 minutes.
Yeah.
And then
it's about a 15-minute curve, isn't it?
But at least I got in my little...
You got a
petty.
Yeah.
My little I sound super petty, but that's just manners, people.
Yeah, well, it's annoying when you dedicate your life to helping other people and people just treat you like trash, you know?
That's the problem. I'm not offended like he thinks little of me. That's not what offends me. What offends me is like just the audacity to be a rude human being. And to be okay with yourself. Like because this guy, just because these patients frequent the hospitals, and just because they don't have their kidneys anymore, and just because, you know, their skin has been yellow for a decade, that doesn't mean that they have rights to, like you say, treat healthcare people like trash and like they own the place, and tell them what to do. So that'll get me when when they don't say please or thank you.
For me, number 2 is when you get those little rugrats in, you know? And I hate to call a kid annoying.
With
but
like their South Park voices.
I can't even do a good South Park voice. And I don't want to try. But like the little kids, and they come in with behavioral problems. And the parents are so permissive.
Oh.
I'm not a parent.
By behavioral problems, do you mean like they pick their nose and suck their thumb at age 17? Or do you mean like...
Well, that's annoying,
Do you
too,
mean
but...
that they like whip out a pistol and like start pointing it at
Basically,
everybody?
Yeah. Like I had this one kid, we were doing a nose swab because he was going to surgery. So we were doing a COVID.
Yeah.
And I was having this other nurse help me. So I was holding the kid down. And she was getting the swab. Because you have to do that with kids sometimes. They're not just going to let you stick something up their nose.
Yeah.
So I was holding him down. And we were done. So she pulled the swab out. This kid slapped her. Across the face. Just like... Oh, that was really loud. I'm sorry. But that's what it sounded like. Just like slapped her straight across the face.
Oh my
We've
goodness.
had kids like kick pregnant women.
Oh my.
And imagine if that was an adult doing that. You know, that's like, boom, you're arrested, you know? But with kids, since they're minors, you let more go. But just behavioral issues is the thing, where they're just little brats, you know? I'm not a parent, but I go home every night and I pray to God that my kids won't be like that. Because I just can't.
After every shift, a vasectomy seems like more
of
like
an I'm telling you, man, working with kids is the best form of birth control there is. You know, I graduated high school being like, yeah, I'd love kids. And here I am now, 24.
griping about them on a podcast.
Yeah.
Well, you get there.
Yeah, it happens. Still want kids, but I'm still like, I'm a little more hesitant about it now. Yeah, that's my number 2.
Child hesitant.
Yeah. Child hesitant.
Okay, here it is. My number 1. My top patient pet peeve is when patients or patient family
I know this one.
when they utter the words, "You haven't done anything."
Oh.
And it's usually out of frustration. Picture, for example, a patient is coming to the ER with like crippling abdominal pain, probably from a kidney stone. And we give them narcotics and fluids and nausea medicine. And the pain isn't gone yet. So these family members will get frustrated, especially because they're waiting hours in the ER for surgery.
Right.
And then in frustration, they'll say to me, "When is a doctor going to be here? Or when is he going to go to surgery? Y'all aren't doing anything for him." And then once they say those words,
You just immediately disassociate.
it's like an out-of-body experience. I feel like myself boil. If you're ever with me, what it usually looks like is that they'll say that and I'll just stare at them for like 10 solid seconds in silence, just to make sure I don't say anything stupid, right? This is what I've had to train myself to do. But when they claim that like I haven't done anything, that is like the most insulting thing you can say, to me at least. I don't know about other nurses out there. but the most insulting thing you can say. And then the doctors get really upset too when they say it to a doctor. But when they say to me, like, y'all haven't done anything, I wait 10 seconds. And then what I usually do is I just recap the myriad of things I've done for them. So
I got you ice chips. I turn on the TV.
No, I'll say like, sir, we scanned your head, we scanned your belly, we x-rayed your chest, and I gave you 3 different painkillers. You cannot say that we haven't done anything for you.
Good for you. Stand up for yourself a little bit there.
So, like, that'll upset them a little bit back to be, like, corrected on the words, you haven't done anything.
Uh-huh.
So I'll usually have to soften it by saying, like, I understand you're in pain. I understand your frustration.
Mm-hmm.
But you can't say we haven't done anything for you, you know?
I mean, they just did a $25,000 workup, so...
Exactly.
That's not nothing.
The plus one, the extra one, if I had to come up with an extra one, is when they come to the ER but then refuse all the treatments we offer.
Oh, that's got to be annoying. Yeah.
And it makes my job easier. That's why it's not my top 5. Like, it makes my job easier if I don't have to do anything for you. But you're, like, one of my coworkers said, so you came to the ER and then refused all our treatment, and you're getting charged like $3,500 for it.
Yeah.
It's a racket.
Put that into just like a Roth 401k, you know, like an IRA. And let that work for you.
All right, Matt. What's the number one thing that annoys you? That patients say or do?
This is more of a patient family type thing. I think my top one has got to be when the mom, it's usually the mom, I'm going to be honest, says, like, I'm a nurse.
Oh!
Within, like, the first, like, 15 seconds that you walk in the room. And, you know, there's good ones, too, where, like, they walk in and it'll just be casually mentioned, oh, like, I'm a doctor. Or it'll get passed along, but they don't make a big deal about it.
Yeah.
You know, it helps me that I know because I can talk to them as a healthcare professional and be like, this is what's going on, and I can use terms that I otherwise wouldn't. But when they're just all up in your business.
Oh, yes.
You know, and they just make it really clear that they're an expert on everything.
Yes. And that your involvement in the case is just a formality. Right.
As a matter of fact, they should be paying me, you know? Or, those are the ones that just kill me.
Matthew, why is your patient's mom signed into iMobile?
She wrote it in, like, the chrono sheet.
The patient's family members clocking in and out. What kind of nonsense is this?
Oh, like, man.
All right, Mrs. Jeffries. Will that be all? It's like, yeah, I'm going to go on lunch now.
It's got to be that one, you know, for me, where they just act like an expert on everything. And even worse, when they act like an expert on everything, and I know they have no idea what they're talking about because it makes no sense what they're saying.
Yeah, I didn't even consider that for my list. When the family members are also in healthcare, because it is hit or miss. They're not like all categorically annoying.
Oh no.
So that's
some of them are great.
Yeah, some of them are fantastic. And like my last shift, my patient was a nurse from Cath Lab herself, and she was the chillest patient ever. So I guess that's why I didn't make it onto the list. But the even like medical students from UT Health, they'll wave their school ID badges at me because, and I had to tell this guy off. He's not even a doctor yet. He's a med student, and he's trying to pull rank already on a nurse. And that was one of the most disappointing things I'd ever encountered in my life. He's pulling rank and like bossing around the techs. So I had to stand up to him and be like, sir, I'm in charge here. And you can't just wave your school ID at us and tell us what to do. And he's like, I'm trying to help you. It's like, you're not helping us. Have a seat. Have a seat in that chair right over there. like, please put away your school ID. Nobody cares.
Yeah. One of the most frightening experiences of my life. It was my last day on my unit.
Mm-hmm.
It was almost shift change, and I took a patient, and I was like, oh, this seems like a chill one. It's like a routine surgery we do all the time. I was like, yeah, whatever. Like, I'll check him in, do all the admission stuff, and pass him on.
Yeah.
So they get there, and I'm like checking him into the room and everything, and I go through all my stuff that I'm supposed to do, and then I'm like, okay, so this is a security. Basically, it's like a security sheet. So it asks, like, blah, 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 anyone who's not allowed to be here, can you sign both your names here? Y'all are the 2 guardians, designated caregiver, blah, blah, blah.
Interesting. Okay.
That whole thing. Pediatric stuff.
Yeah.
And the wife signs it, and I look at the name, and I'm like, this is so familiar. And it took me a second. And I'm like, oh my gosh, this is one of the hospitalists that work on my floor. And I didn't recognize, because they're in like street clothes, you know, and they have their mask on. And
but she didn't like introduce herself as one of the hospitalists on the floor.
She was just sitting there, and I was like, okay, like, this is what we're looking for, this is what we're doing. And she's like, okay, cool. And then she's like, are we allowed to like feed, like give them the formula and stuff? I'm like, well, we're gonna start off unclear, so like let's do like Pedialyte first, and then kind of work our way up. And she's like, okay, cool.
Wow.
And that was one of the best ways to leave my floor.
I feel like we were able to get a lot off our chest with this episode.
That felt more like therapy than anything.
It was cathartic. Well, we think it's interesting. We hope you think it's interesting too.
Yeah.
Top pet peeves. I'm David.
I'm Matthew.
This has been